You may think that snoring or waking up tired is just a normal part of aging, but the truth is that these could be warning signs that your body is not getting enough oxygen during the night. This condition, known as sleep-related hypoxemia, is far more dangerous than most people realize. When oxygen levels drop and carbon dioxide builds up, your body goes into stress mode. The sympathetic nervous system activates, blood vessels tighten, the heart beats faster, and blood pressure rises. Instead of resting, your body is fighting to survive. Over time, this hidden struggle damages the heart, the brain, the kidneys, and every organ that depends on oxygen. Seniors with untreated sleep-related hypoxemia face higher risks of hypertension, heart attacks, irregular heart rhythms, and strokes. Sometimes even sudden death during sleep. What makes this problem especially frightening is that many people do not know it is happening. They may believe they sleep soundly through the night, but in reality, their brain and heart are being starved of oxygen. Morning headaches, fatigue, memory problems, and irritability are all clues that your body is suffocating silently. In this video, I will reveal 5 hidden dangers of low oxygen at night and 5 safer choices that can protect your heart, your brain, and your future. These are not just medical theories. They are life-saving truths supported by clinical research and patient experience. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 so I know how to make better content for you. Part 1. What is lack of oxygen when sleeping? The first thing you must understand is what really happens when the body lacks oxygen during sleep. This condition, called sleep-related hypoxemia, is not simply about snoring or feeling restless at night. It is a medical phenomenon where the level of oxygen in the blood falls below what the body needs. While carbon dioxide levels rise, oxygen is the fuel for every organ, especially the brain and the heart. When you sleep, your breathing naturally slows. But if your airway collapses or your lungs cannot take in enough air, oxygen drops quickly. The body senses this drop and responds by activating the sympathetic nervous system, the same system that reacts to danger. Your blood vessels constrict, your heart races, and blood pressure rises. Instead of resting, your body enters a stressful state again and again throughout the night. Over time, this constant stress leads to hypertension, arrhythmia, heart failure, and cerebrovascular disease. In fact, studies show that the risk of death increases as the number of apnea episodes per hour rises. The more times your breathing stops at night, the higher your chance of heart attack, stroke, or sudden death. What makes sleep-related hypoxemia so dangerous is that many people do not realize they have it. They believe they sleep peacefully, unaware that their brain and heart are being deprived of oxygen. In the morning, they may complain of headaches, fatigue, or poor concentration, never linking these symptoms to what happened during the night. Seniors are especially vulnerable because aging weakens the muscles that keep the airway open and reduces the body's ability to compensate for oxygen loss. But anyone can develop this condition, even those who appear otherwise healthy. Recognizing that sleep is not always safe is the first step toward prevention. Sleep-related hypoxemia is a silent attacker, striking when the body should be healing. If left untreated, it can lead to permanent damage or sudden death. But the good news is that once you understand what it is, You can begin to see the causes and take steps to correct them. If this has opened your eyes, wait until you hear about the next part, where we explore the main causes of low oxygen at night and why certain people are more at risk than others. Part 2. Causes for lack of oxygen when sleeping. The second thing you must know is why oxygen levels fall during sleep and who is most at risk. While anyone can develop sleep-related hypoxemia, certain factors make the danger much greater. The most common cause is excess weight. More than half of people with sleep-related hypoxemia are overweight. Fat deposits in the neck and throat narrow the airway, making it easier for the airway to collapse when the muscles relax at night. Yet, it is important to note that thin people are not immune. Even those without excess weight can experience this condition if their airway anatomy is unfavorable. Neck size itself is a powerful predictor. A thick neck can physically narrow the respiratory tract and is often linked with obesity. Studies show that men with a neck circumference greater than 17 inches and women with a circumference greater than 15 inches face a significantly higher risk. Hypertension is another major contributor. People with high blood pressure are more likely to suffer repeated oxygen drops during sleep. This creates a vicious cycle where poor sleep worsens hypertension, and hypertension, in turn, worsens sleep-related breathing disorders, narrowing of the airway from enlarged tonsils, a naturally narrow throat, or chronic nasal congestion can also block airflow. Seniors with chronic sinus problems often experience double the risk of oxygen deprivation at night. Diabetes adds another layer of danger. People with diabetes are 3 times more likely to develop sleep-related hypoxemia, partly because of metabolic changes and partly because diabetes often coexists with obesity and vascular disease. Age itself is a strong risk factor. Adults over 65 are 2 to 3 times more likely to experience oxygen drops during sleep. After menopause, women become more vulnerable, showing that hormones play a role in airway stability. Smoking further increases risk by inflaming and damaging the airways, making them more likely to collapse. The combination of smoking and lung disease magnifies the danger of nighttime oxygen deprivation. What makes these causes so dangerous is that they are often silent. People may believe they are simply tired from age or stress, when in fact their bodies are suffocating a little bit every night. Recognizing these risk factors is essential, because the more risk factors you have, the more urgent it becomes to act. Awareness is the first step toward prevention. If you see yourself in any of these categories, take it as a warning. The next step is learning how to recognize the warning signs. If this has made you cautious, wait until you hear about the next part, where we uncover the most common signs that your body is lacking oxygen during sleep and how you can detect them before it is too late. Part 3. Signs of lacking oxygen when sleeping. The third thing you must pay close attention to is the set of signs that reveal your body is not getting enough oxygen during sleep. These signs are often dismissed as harmless or blamed on aging. But in truth, they are red flags that your brain, heart, and lungs are under attack at night. The most common and obvious sign is snoring. While many people treat snoring as a simple nuisance, it is actually one of the clearest indicators of sleep-related hypoxemia. Loud snoring, especially when accompanied by snorting, choking sounds, or pauses in breathing, suggests that the airway is collapsing repeatedly during the night. Each pause is a moment when oxygen is not reaching the body. Another warning sign is excessive daytime fatigue. People who suffer from oxygen deprivation often wake up feeling unrefreshed, even after what seemed like a full night of sleep. They struggle to concentrate at work, lose interest in activities, and may even fall asleep unintentionally during the day. This daytime sleepiness not only lowers quality of life, but also raises the risk of traffic and workplace accidents. Morning headaches are also a common clue. When the brain does not receive enough oxygen at night, carbon dioxide builds up, leading to vascular changes that cause pain upon waking. If you regularly wake with headaches, this may be a sign that your brain is being deprived of oxygen every night. Memory problems, mood swings, and irritability are further consequences. Hypoxemia starves the brain, leading to difficulty focusing, forgetfulness, and emotional instability. Families often notice their loved one becoming more short-tempered or withdrawn without understanding that the real cause is poor oxygenation during sleep. Restless sleep or frequent awakenings can also signal oxygen deprivation. Some people wake up gasping or choking, while others toss and turn throughout the night without realizing why. Even children can show unusual symptoms such as hyperactivity or trouble paying attention, which may be linked to oxygen problems during sleep. These signs should never be ignored. They are the body's way of sounding the alarm that oxygen supply is unstable. If left untreated, these nightly episodes accumulate damage in the heart, the blood vessels, and the brain. The danger grows silently until it results in hypertension, heart disease, or sudden death. Recognizing these early signs is the most powerful step you can take toward protection. If you or someone you love shows any of these symptoms, seek medical evaluation without delay. Remember, silence does not mean safety. Many people think they sleep peacefully, but their body may be fighting for oxygen every night. If this information concerns you, wait until you hear about the next part, where we will examine the severe health risks that arise when sleep-related hypoxemia is left untreated, and why it can lead to life-threatening conditions such as heart attack, stroke, or brain hemorrhage. Part 4. Health risks of long-term sleep-related hypoxemia. The fourth thing you must understand is just how destructive long-term sleep-related hypoxemia can be to every system in your body. When oxygen levels fall during sleep, the brain and heart suffer first. But the damage does not stop there. Over time, nightly oxygen deprivation creates a chain reaction that weakens blood vessels, disrupts metabolism, and increases the risk of sudden death. One of the earliest consequences is hypertension. Each episode of oxygen drop triggers the sympathetic nervous system, which raises blood pressure. When this happens dozens or even hundreds of times each night, the blood vessels remain in a constant state of stress. Eventually, this leads to chronic hypertension that is harder to control with medication. High blood pressure itself becomes a driver of heart disease, stroke, and kidney failure. The heart faces even greater risks. Without enough oxygen, the heart muscle becomes strained, and irregular rhythms develop. Arrhythmias, such as atrial fibrillation, may appear, increasing the likelihood of blood clots that can travel to the brain. The result is a higher chance of ischemic stroke. In some cases, the electrical system of the heart fails completely, leading to sudden cardiac arrest during sleep. Heart failure is another outcome, as the heart gradually loses its ability to pump efficiently after years of oxygen deprivation. The brain also suffers deeply. Repeated oxygen shortages damage small blood vessels in the brain, leading to vascular dementia, memory decline, and increased risk of hemorrhagic stroke. Seniors who live with untreated hypoxemia often show accelerated cognitive decline, losing independence sooner than expected. Morning headaches, confusion, and difficulty concentrating are warning signs of this ongoing brain injury. Other organs are not spared. The kidneys, pancreas, and lungs are all affected by poor oxygen supply, leading to metabolic disorders, worsening diabetes, and reduced immune function. Research shows that untreated sleep-related hypoxemia triples the risk of developing coronary artery disease and cerebrovascular disease. For some, the first sign of this condition is not fatigue or snoring, but a catastrophic event like myocardial infarction or brain hemorrhage. The short-term risks should not be underestimated either. Fatigue and daytime sleepiness increase the chance of accidents while driving or working. In children, oxygen deprivation at night can cause hyperactivity, learning difficulties, and growth problems. The longer hypoxemia is ignored, the higher the chance of irreversible damage. The tragic reality is that many cases end with sudden death, often described as going to bed appearing well but never waking up. This is why awareness and timely treatment are critical. If this warning has unsettled you, wait until you hear about the next part, where we will look at the treatment options available, from simple lifestyle changes to advanced medical devices, and how these can restore safe oxygen levels at night. Part 5. Treatment options for sleep-related hypoxemia. The fifth and final part you must learn is that while sleep-related hypoxemia is dangerous, it is also treatable if addressed early and properly. The right treatment depends on the severity of the condition, ranging from simple lifestyle adjustments to advanced medical interventions. For mild cases, the focus is on changing habits that worsen oxygen deprivation. Weight management is one of the most effective strategies, as excess fat around the neck and chest increases airway collapse. Even a modest reduction in body weight can improve oxygen flow and reduce the number of apnea episodes per night. Seniors should also avoid alcohol, smoking, and sedative medications before bedtime, as these substances relax the airway muscles and suppress breathing. Sleeping on the side rather than on the back can reduce airway obstruction, and specialized pillows or chin straps can help keep the airway open. For moderate cases, medical evaluation is essential. Some patients benefit from surgical procedures, such as uvulopalatal-pharyngoplasty, which reshapes the soft palate, uvula, or removes enlarged tonsils that block the airway. Surgery is not for everyone, but in cases where anatomical abnormalities are the cause, it can significantly reduce the risk of oxygen deprivation. The most proven and effective treatment for moderate to severe cases is continuous positive airway pressure therapy, commonly called CPAP. This involves wearing a mask over the nose or mouth during sleep, which delivers a steady stream of air to keep the airway open. CPAP has been shown to reduce daytime sleepiness, improve blood pressure, lower the risk of cardiovascular events, and restore safe oxygen levels throughout the night. Although some patients find it uncomfortable at first, with proper guidance and persistence, it becomes life-saving. In addition to CPAP, other devices, such as mandibular advancement appliances, may help by repositioning the lower jaw to widen the airway. Seniors with chronic lung disease may also benefit from supplemental oxygen therapy prescribed by a physician. Lifestyle support remains critical at all levels of treatment. Regular exercise during the day improves heart and lung capacity, while good sleep hygiene, such as maintaining a consistent bedtime routine and keeping the bedroom free from pollutants, strengthens results. families should be actively involved, helping monitor symptoms such as snoring, gasping, or unusual restlessness. Medical follow-up is equally important, since untreated hypoxemia can return even after initial improvement. The key message is that sleep-related hypoxemia is not a hopeless condition. With the right combination of lifestyle change, medical treatment, and ongoing care, oxygen levels can be stabilized, risks can be reduced, and quality of life can improve dramatically. If this part has given you hope, stay with me for the conclusion, where I will remind you why it is never too late to protect your health, and why every step you take tonight can help you wake safely to a healthier tomorrow. Conclusion. We have now walked step by step through the reality of sleep-related hypoxemia, a condition that silently deprives your body of oxygen during the very hours when it should be healing. You have learned what it is, what causes it, the signs that reveal its presence, the serious health risks it brings, and the treatments that can make a life-saving difference. The message is simple but urgent. Sleep is not always safe, and if oxygen drops are left untreated, they can damage your heart, your brain, your blood vessels, and every organ that depends on oxygen over time. This leads to hypertension, heart attacks, strokes, memory loss, and in too many cases, sudden death during the night. Yet despite these dangers, many people still dismiss the symptoms. They explain away snoring as just a nuisance, or they tell themselves that fatigue, morning headaches, or poor memory are just signs of aging. The truth is that these are alarms your body is sending you, alarms that you cannot afford to ignore. The good news is that it is never too late to act, whether by making small lifestyle changes, managing weight, quitting smoking, treating chronic conditions, or using devices like CPAP. You can protect your oxygen levels and reduce your risks. Even modest improvements in breathing at night can lower blood pressure, restore energy, and improve mental clarity. Your body still remembers how to heal, even after years of strain. By giving it the oxygen it needs, you give yourself the chance to live longer, healthier, and safer. Share this knowledge with your loved ones, because too many families discover the danger only after tragedy has struck. Awareness and action can prevent that pain. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned from this video and plan to apply in your own life. Let us support each other in building healthier habits and safer nights. If you enjoyed this video, comment 1. If not, comment 0, so I know how to make better content for you. Do not forget to like, share, and subscribe so you never miss another health tip made especially for seniors. Remember, every night can either heal you or harm you. The choice begins with the actions you take today. Protect your sleep, protect your oxygen, and protect your life.